So I'm here with Blue Cross Blue Shield Association CEO Kim Keck to discuss a recent report and press release on maternal health that has some disturbing results regarding Black women and severe childbirth complications. Welcome and thank you for joining us.
It's great to be with you.
So my first question is, what prompted the BCBSA to conduct this research, and what were some of the most startling findings?
Yeah, sure, Ellis. So earlier this year, we did at the association, Blue Cross and Blue Shield Association, announce a multi-year national health equity strategy to really confront health disparities and reimagine a more equitable healthcare system. And our first focus is on maternal health, and more specifically on reducing health disparities in maternal health by about 50% in 5 years. So
Wow.
I know it's a bold goal, but it's important. And a key component of this is collecting data, because, right, we have to understand our starting point. We have to understand rather the progress we're making. And as you suggested, we put out a recent report. And then in that latest report, we analyzed 2.2 million births covered by Blue Cross and Blue Shield insurance from 2018 to 2020. And what we, or rather 2020, and what we learned is there was some pretty significant discrepancies between women of color and white women. More specifically, Ellis, we looked at something called SMM, or severe maternal morbidity.
Right.
That's a measure that the CDC uses to talk about unexpected outcomes in childbirth or in pregnancy. Things like kidney failure, respiratory distress, eclampsia, which can sometimes lead to death. And as I said, SMM rates are 60+% higher for Black women than white women, and 30+% higher for Hispanic women. And then importantly, we also found that Black women who are young, like 24 and younger, still have higher rates of what's called this SMM than white women over 35. And that's traditionally considered the high risk group, right? When you're 35,
yeah, that's
right? So it's really startling. And in addition to that, one of the things in our latest report is some empirical analysis, or really just data. We interviewed women and said, tell us about your experiences about receiving care during pregnancy and childbirth. And we found that Black women and Hispanic women face barriers getting the care they want, like, well, certainly their prenatal visits, but like because of issues like transportation, right, or inconvenient scheduling. They can't get time off work, right? So it's clear we have a lot of work to do.
Absolutely, absolutely. And one of the things that I saw in the press release, that you stated there is an urgent maternal health crisis in our country. What did you mean by that? And how do you think we got to this point as a country with an overall high quality of healthcare available to us?
Yeah, good question. And most people don't know this, Ellis, but it's in the United States, we are more than twice as likely to die from complications related to pregnancy or childbirth than those in other high-income developed countries in the world. I mean, that's just inexcusable, right? It's actually almost mind-numbing. And Black and Hispanic women in particular are disproportionately impacted. And that was what some of our latest findings articulated. We know racial disparities in maternal health care are complex. They're certainly not a one-dimensional issue, and it's not going to have a one-dimensional solution rather. So to your question of, how do we have such high quality in healthcare and yet these data and these issues exist? I mean, there's a lot of issues underlying the maternal statistics that I shared. And at Blue Cross and Blue Shield, we insure 1 in 3 Americans. And so we have a bunch of data, and we understand some of the underlying root causes, like maternity care deserts. So people live in a place there's not access to care. There are certainly higher rates of underlying chronic conditions. Like I said, limited access to healthcare is an issue in many places. There's also bias and disparities that are just inherent in our systems. Right. And as I said earlier, right, some of the traditional things that some of us take for granted, like being able to get time off of work or get a ride to our physician's appointment, our pediatrician or OBGYN's appointment, those barriers exist, and they're more significant in some places. So it's clear that there's substantial disparities facing women of color. And even within our overall high quality system in the United States, there's work to be done.
So you talked a little bit about it, but I want to give the opportunity now to talk about what is your organization doing to help curtail some of these issues.
Yeah. Well, we're doing a number of things and asking for a number of leaders and organizations to join us because, as I said, this is a complicated issue and it will take all of us to lean in. So I'd say we're looking at working with providers, first and foremost, right? Physicians who are on the front lines of delivering care to ensure things like even sometimes basic things like strong patient communications. Does the patient understand what you're asking or sharing with them? Are you giving culturally competent care? We're even, as you mentioned earlier, and as I talked about a second ago, collecting data to measure disparities. We're doing things like doing training, unconscious bias training with providers as another example. And importantly, we're counting on experts. We convened an advisory panel of top experts and advocates in health equity more broadly to share their perspectives with us and guide our work. And then I think one of the last things I'd mention, because we're doing many things, as I suggest, this is an issue that requires lots of attention, but we're advocating for public policies at both the state and federal level, because I don't think, as I said earlier, there's really one issue that can address some of these underlying issues. You know, the discrimination, racism, unconscious bias have really existed for so many years, and it's time to put an end to disparities in healthcare. And working together, communities, providers, partners, we can do this.
Well, I just got charged up. And so, but you're absolutely right. I think we have a multifaceted problem, and that requires a multifaceted solution. And ultimately, that's the approach you're taking. I completely agree. So, with you being your organization being one of the largest providers, do you think this will start an industry trend to have maybe other companies follow suit and say, hopefully, maybe they can address, if not this disparity, but other disparities?
That's the goal. Absolutely. So, you know, it shouldn't be that your health is dependent on the color of your skin or the zip code that you live in. It's just really unconscionable, because often that is the real truth for so many of us. And these issues are not new, but I do believe we have an opportunity to lean in, and we're starting to see it. And I'm excited about that. And I sometimes use the analogy, Alyssa, if we think about what happened in the last year, right? If you rewind the clock to the beginning or even the spring of 2020, and we thought about all of the ways we as Americans mobilized on the COVID front, right? Even in terms of the vaccination, right? The research and development, the testing, the manufacturing, the distribution, the administration to get shots in arms. Here we are, you know, at north of 50% of the country with some dose of vaccine, right? Just imagine if we could mobilize that kind of all-in force to confront racial disparities, what we could do.
Well, as my D&I professors would say, thank you, and I appreciate it. I appreciate what you're doing. So, I guess my last question for you is kind of one is, well, how can we help? How can average citizens? How can your cardholders? How can we all help and pitch in? Because I know we've got the corporate side, we've got to work on policy, but how can average everyday citizens help you in this effort to close this gap in terms of SMM?
Sure. So one of the easiest and some respects also the most pressing ways to help is to contact your delegation in the U.S. Senate and the House of Representatives and say, look, support the Black Maternal Health Momnibus Act of 2021. It's a little bit of a mouthful, but embedded in this Momnibus Act, it addresses underlying root causes, what we call the social determinants. It improves access to healthcare coverage. More specifically in the Momnibus, the mom part of the Momnibus, things like even access to postpartum depression, because too often that goes undiagnosed, particularly people of color. And so this combinations within of bills within the Momnibus Act is a really simple thing to do. As I said, I think we can all take meaningful action, and just that simple step, I think, will coalesce between policymakers, community advocates, industry leaders, and really, I believe, make measurable progress for the health of all Americans.
Well, I wanted to say, on behalf of my doctor, I want to say thank you for your time and your dedication to this issue. Please know that you have our support. Anytime you want to come back and give an update, we'd love to have you back to give an update on how you're progressing, and let us know how we can help in any way. So we're here for you. And thank you again.
Thank you. I appreciate the opportunity to speak with you.